Hello, hello, hello. So glad to be back and have a delightful, beautiful conversation around maternal health. You see the title, Heart Disease is the number one killer of new moms, especially dealing with women of color. Black women are 1 to 3 times more likely than white women to have a high mortality rate. Far too many moms are dying because of maternal health. It's so important to find ways to support new moms that are thinking about getting pregnant, moms that are already pregnant, and going through the postpartum process. It starts from conception all the way through the birth, through delivery, and taking care of the new bundle of joy. The US, the United States, has one of the highest mortality rates. And for this, we must continue to have discussions, educate ourselves, do our research, and make sure that we have everything that we need to make sure the needs are met, our voices are heard, and the concerns are met. Do not ever feel like you're in a situation where you are expressing your needs and a want, especially dealing with pregnancy, and you feel as you are being unheard. I am Leslie Jordan. I had the pleasure this year of being a part of the American Heart Association, Go Red for Women, Real Class of Real Women 2023. I am a stroke survivor. You are more than welcome to find out more about my story. Please do go to goredforwomen.org. There are plenty of beautiful heart stories, my heart stories of moms, heart stories of women that have gone through cardiovascular disease, heart disease, strokes, that are still here advocating to make sure that you watching or someone that you know that may be going through a beautiful change, such as pregnancy, that needs to hear this discussion. Again, this video is not sponsored by the American Heart Association or its affiliates. This video is not a substitute for medical advice. Please see a licensed or medical professional. If any mental needs, this video does not take care of any mental health awareness or needs or services. Please see a licensed therapist. So let's go ahead and get into it. We have a beautiful special guest. I am so excited that she is here to speak with us today about the importance of maternal wellness and helping us find out ways that we can support our new moms, or if you're the one going through pregnancy right now or postpartum, thinking about pregnancy, how you can support yourself to make sure that you are not part of the one of unfortunately many moms that are dying due to pregnancy related deaths. Our special guest is Alexis Scott. She is a doula and soon to be certified midwife. I am so excited for her to be here. She is going to share a wealth of knowledge, a lot of great advice, ask questions that we've been wanting to probably ask for a while to make sure that the process when you're going through pregnancy is healthy for the mom and healthy for the baby. Doulas and midwives work together to support women during their pregnancy and childbirth journey. While doulas focus on providing emotional and physical support, midwives provide medical care and support throughout the entire pregnancy and childbirth process. Both professionals play important roles in helping women have positive birth experiences. Without further ado, let's get into our special guest, Miss Alexis Scott, who's a doula and soon to be certified midwife. How would you support new moms or women that are pregnant? Maybe they've already had children or in the process of having more children that do not want to necessarily admit that they're struggling in a mental capacity to take care of their own selves and they don't feel like they can fully step into the role of being a new mom. Maybe there's a sense of shame, whether it's a culture or society, or they placing expectations on themselves, or maybe it's that they don't have the support group, they don't know how to ask. So as a doula in that situation, how would you support that mom and helping them with their emotional well-being?
Well, first just kind of address it and let them know there's nothing to be ashamed of. It's really not. And just in general, when it comes to mental health, especially, um, as women, there's like a lot of weight put on your shoulders as if you're supposed to be the like emotional standard for everything. And it's like some of us we're not developed. It's okay. Um, so first I'd say, look, there's no reason for you to feel guilty or feel ashamed or anything. Everybody looks at motherhood different. Everybody's situation is different. So there's nothing to be embarrassed about. You shouldn't be so hard on yourself. And it's easy to say from the outside looking in and telling someone, hey, you shouldn't be hard on yourself. But I would start there and then ask them, hey, so what is making you feel this way? Why do you feel like this? Why are you feeling like you're not a good mom? Why are you feeling like you're not able to? What can we put in place and what can I help you do to make you feel better about those areas? Or can I take some of this responsibility off of you? For example, with postpartum doulas, a lot of them end up staying overnight and cooking dinners and things like that. So, okay, can I help you in that capacity? Can I take some of that weight off of your shoulders? Because I know maybe you don't have the same type of village that somebody else has. So, can I take some of those responsibilities away from you so you can rest and get a chance to think about yourself? Or is there something that you and your partner need to do on your own that I can help take care of it from this end so that you can feel like a good you? Like I said before, you can't be a good mother if you're not a good you. So what can we do? What can we put in place to make sure that you feel good on your own? And then get into the things like, okay, well, what part of motherhood is scaring you the most? Like now that baby's here, what do you feel like you need help with? Okay, are there resources for that? Can we find resources to help you with that? And let's say you're dealing with someone that's low income. Have you looked into this? Have you done this? Just asking the questions to help find the answers that they need, as far as just regular resources, support, or anything like that.
I love that you said low income or maybe lack of resources at that time, because sometimes you can't have money, but you're overextended. So you may not feel you have that budget to meet a need such as a doula. How affordable can doulas be, or is that something that you can look into your insurance? Are there maybe public programs that can help people that may, or women in general that may not feel or know that they can afford or feel like they cannot afford the doulas? Like, how affordable could they be if that's the case?
It kind of just depends person to person. So a lot of doulas don't necessarily work. They're freelance workers. So some of them have a sliding scale. I do know I live in Virginia. So I do know at one point they were trying to see if it was something that they could get covered by Medicaid, but I'm not quite sure how far that legislation has gone or if they've even advanced it at all. I do personally think that that should be something, or at least maternal health care should be something that's included in Medicaid just in general because they need it just as much as somebody who can afford it. I, in the next, I want to say once I'm done with school, maybe within the next like 5 to 7 years, my goal is actually to work in that type of space. I want to start my own birthing center that is geared towards low income and marginalized groups, just because there's a gap right there for the type of care that they need. Because again, these people, because of their issues with the fact that they have to rely on Medicaid or no insurance at all, they're kind of forced into going to a hospital instead of a birthing center or something like that, where they can have more personalized care. And I personally feel like no person should be ignored when it comes to a birthing process. It's more than anything, it's dangerous. So every single woman should have the opportunity to feel supported in that manner. And from what I've seen, low income women just don't really get that advantage because they can't afford they can't afford a doula, they can't find a midwife that accepts Medicaid. Um, Going to the doctor is their only source of maternal help when they're on their journey, so they don't really get that same opportunity.
And that is far too unfortunate and common, that women that go into pregnancy with the idea that there's going to be a sense of care, and sometimes that care may not be available simply because of either their race or their social economic status, or potentially the location or the environment that they're in. I noticed that you mentioned birthing centers and hospitals. There is a stigma that if you are a woman of color, birthing centers may be more of an alternative than going to the hospital. However, some birthing centers may not be equipped to what hospitals offer. So when a woman is trying to figure out what's the safest way for her to have a healthy pregnancy for herself and the baby, what would be some of your recommendations, or what have you seen as far as what's going on now as to how they choose to proceed to have or give birth?
So many people are getting doulas just for that reason, because they can stay the whole entire course of the pregnancy. So even if you're in the hospital, I know at the hospital that I work at, they allow doulas as part of your birthing team into your hospital room. So visitors are still kind of limited post COVID, but doulas are welcome and they want them there. So a lot of people are going that route, but I personally feel like if you can afford it, or if your insurance covers it, to get a midwife, because having somebody like that part of your medical team, because they're trained medically, it's very advantageous, because they're there for the whole entire pregnancy. And I feel like the biggest issue with an OB, and I'm no shade to them, is the fact that they cannot, there's a possibility that they won't be there at the end. So I can see the same OB every single month or every time I have an appointment, but on the day I give birth, there somebody else is on call. And that can be really scary if you have a high risk pregnancy, because if you have a high risk pregnancy or you're having multiples, you can go into a birthing center might not necessarily be the best choice, just because they like you said, they're not equipped to handle something like that. But at the same time, I want that same comfortability that I would have at the birthing center, because it's a closer knit group. So honest, it depends on the hospital, depends on the area, but a lot of hospitals are now allowing outside sources to come in and be a part of a birthing team. And it's dependent upon your birthing plan. I think I said this to you before. It's really important as a mom, when you become pregnant, to start to develop a birthing plan. So you know, and you can have on paper, look, this is what I want. And then you can your medical team can say, all right, this is feasible, or 100% this is great. Or okay, well, based off of the type of pregnancy you're having, or based off of your medical history, these certain pieces are not as feasible. And then you can take it to your doula and say, okay, well, what do I need to add in here to make sure that this experience is a good experience? Because like I said before, pregnancy is dangerous. Having a baby is dangerous. People need to have comfort in in the way that they're giving birth, and how everything around them is going to happen, especially depending on the location.
I think you're absolutely right how serious pregnancy is. It's definitely not something to be taken lightly. It's something to be taken very, very seriously, with caution, with preparation. And with that preparation, I noticed you said birthing plan. How common or should it be something that everyone is doing when they're going into pregnancy? Should we be making birthing plans? What should that birthing plan probably have? What do you think is the most important thing, if we only have maybe one or two or three things when it comes to a birthing plan, to make sure that we can just use that as another supportive factor to try to make sure that mom's healthy and the baby's healthy during pregnancy?
I do think that if someone has an opportunity to make a birthing plan, they should, for the most part. I, for the most part, I think that many medical facilities will have you make one in the beginning. But just like anything, me personally, I'm a super planner. I need a rough draft. So before I get in there, I want to tell you, like, okay, this is what I'm looking at. And I'm very big on research before, or like trust but verify when it comes to anything that has to do with my body. So when I go to the doctor and they say, these are the things that are wrong, okay, I trust you because you're a doctor, but I need to verify this because at the end of the day, it's my body and I want to make sure that I'm okay. And the same goes for if for a pregnant person, this is my body. This is my baby. I want to make sure it's okay. You're a physician. I trust you, but I need to verify that this is okay. So I want to go in there with this is what I have. So the physician can look at it and say, okay, these are the things that are feasible for your pregnancy, and based off of your medical history, this is what we can do. And then, like I said, you go to your doula and say, all right, this is me and the physician have agreed that this plan right here, this is what's feasible, this is what's going to work. Here are my questions from a emotional standpoint. This is how I feel like me having to go to the hospital because I have a high risk pregnancy. This is how that makes me feel. What can I do? What can I do to decrease the chance that I'm going to be super, super stressed out from the very beginning? Because although I'm not a first time mom, I have two kids who are still in diapers. What am I supposed to do? How can you help me through this on this end, based off of all of the other things that my doctor has put inside, or me and my doctor have put inside this birthing plan?
Love that. It seems like a doula or going to a medical professional with a birthing plan seems like it gives mom time to address her concerns, whether it's a feeling
Mm-hmm.
or a thought, and that can try to hopefully manage or minimize some of the stress that mom might be feeling, because pregnancy does come with a lot of stress. It's mentally, emotionally, physically, stress on the body, hormonal changes, and stress in itself is just that, stress. But the problem and concern in most cases is when stress becomes chronic, when it's affecting, mom's capability to live her everyday lifestyle, to potentially affect the baby while she's in the pregnancy as well. With stress and having like maybe emotional support such as a doula, what are some of the things that women should be asking from your perspective as a doula when they're have concerns or they have this emotional need or feeling, to make sure that they at least feel going into the process of pregnancy that they'll feel okay when they're talking about their birthing plan?
Um, I would say if there's any type of like medical symptom or feeling, stay away from Google. Dr. Google is not the answer. Go find a medical professional. They can help you so much, because I feel like a lot of people get caught up in the whole, all right, well, I feel this weird pain. So I'm gonna Google it, and then the pain is like you're about to have a miscarriage, and the person starts freaking out and working themselves up when half the time it was gas. So it's stuff like that. Like if it's a medical issue, try to speak with your medical professional as soon as possible. And then on the emotional end, just I feel like check in with yourself. First things first, check in with yourself. Okay, how do I feel today? I'm on the last day of my third trimester. I'm getting more and more nervous as I'm going into motherhood. Okay, well, if that's how I feel, I need to consult with some resources, maybe a parent, maybe a close family friend, maybe a doula, anybody. I need to talk to them so that I can get more of an understanding of what I have going on. All right, now that I've checked in with myself and I know why I'm stressing, we can find resources. I can help myself or find someone who can help me. I think one of the big things that women in general kind of gloss over is the excitement of motherhood is there, but once that excitement starts wearing off and reality starts to check in, the disconnect happens right there. Like it switches so quick that nobody, like, they're what's the word, they're kind of they're kind of stuck in a way, because like, oh my god, wait, I was just really excited but now I'm super nervous. And it's the if people don't check in with themselves regularly during during the course of their pregnancy, that switch can happen very easily. And once that happens, that's when the stress levels rise. And as you know, because of your situation when you were giving birth, heart issues can happen, and you can make it worse if you're stressed out. It can lead to low fetal or low birth weights and preterm labor. And those are the types of situations that we want to avoid. And just like anything else, stress can come from anywhere, and it's about being able to manage the stress as it comes along. So is it intrusive thoughts? Because if it's that, then you can talk yourself down. Is it environmental? Then okay, well, maybe I shouldn't, maybe if I have time I should take some time off work. Or if I can't afford to have time, maybe instead of um eating lunch at my desk or something like that, I go sit outside where I can get some fresh air or something different. Is it a social aspect where I don't have community? The good thing is now that we have the internet, you can go on there and you can find support groups for people who also don't have villages. So it's just kind of like looking and seeking help and not being afraid to say, hey, I need help, because it's very scary. It can be very daunting, the amount of stress that they can get when they're beginning their birthing process and even in it.
I love that you have kind of honed in on how important it is as a new mom or a woman that is currently going through pregnancy or thinking about pregnancy, that your voice is one of the most powerful things going through the pregnancy process. You have to speak up for yourself. You have to let the medical professionals know. You have to let, if you're fortunate to have a doula, your support system, someone needs to be by your side so they can speak on your behalf. Because as you said, we get stressed. We don't necessarily always have the answers. Sometimes, like you said, we're going on Google and we're creating these stories that may not necessarily be true. But if we're going along with a narrative that could potentially cause more stress, that's not going to help the mom, and it's surely not going to help the baby.
I think it's really important to not compare pregnancy to pregnancy, because even one person can have two different types of pregnancies. So that's another thing that you often see is women work themselves up. Well, my best friend, when she was pregnant, she didn't have this, and this. Like, is there something wrong? And it's like, no, that's just her personal situation. And it's okay that that's different. They're going to be different. So I feel like women shouldn't play the comparison game when it comes to pregnancy. And even if it's their second or third child, like they're sometimes things change over the course of time. So just being very settled in oneself is important.
What would you say for a new mom or woman that's going through pregnancy? What would you say to them if they feel that they've done the research, they've gotten the support, but they're still not getting what they need as far as their needs met? And or if they're in a situation where they're not able to have a doula or that service may not be available, unfortunately, for whatever reason, what can they do to make sure that their needs are met? Or at least what they're saying is taken seriously enough, just in case down the line it may prevent something as serious such as preeclampsia, which is a pregnancy condition that can lead to stroke, or any other heart condition or life-threatening condition that potentially occur if their needs are not addressed timely and seriously.
If it's something that is medicinal, I would say seek help immediately, even if that means going into the ER, which I know for some it's expensive. So going there might not necessarily be the easiest thing for someone to do because they know that that's going to come with a large bill later. But if it's medical, go find a medical professional to get that seen. If it's something that's emotional or financial, reach reach out for anything. And this is an area where you do use Google. There's so many resources online that people just are not aware of. So every state has a research or has a list of resources that they can give for how you can increase your financial wellness and make sure that you have, WIC or whatever is needed financially, or even if it's just like a temporary job board, a lot of insurance companies cover formula and all types of different things like that. Uh, Places like Target and Baby List and all those, and Amazon, they have a baby gift basket when you sign up for one of their registries. So it's all about looking up resources, and on top of that, writing down what your needs are, because they're going to change over time, and you need to know, okay, this is what my need was at this point. Do I still need this, or is this something that I've worked past? Um, it's about being very in tune with oneself, because you can ask for help 150 times, but if you don't 100% know what your needs are, people can't really help you. So it's about knowing yourself just as well as seeking the resources.
I think that's so important as a woman that has gone through pregnancy, and knowing that we have to believe ourselves and know that if something's wrong, we have to speak up. And in my case, it was life saving. And for that, just having that knowledge and being able to speak up and be an advocate during such a critical time when it was life or death for me was absolutely life saving. So if you're watching and you're pregnant, or you're thinking about being pregnant, or you postpartum, if you feel that is something wrong, then just as Lexi has said, go seek a medical professional. If that professional is not listening to you, find another professional. Do not give up. Know that what you're going through is serious. You're not being a drama queen. You're not being overly emotional. You're just being a concerned mother or mother to be. Now, one thing that I'm curious about with a doula, and I know you said pregnancy and postpartum. Is a doula, like, when is a starting and a stopping point for a doula? Like, what is the duration that a mother or new mom can expect to have a doula during their pregnancy process?
So from the very beginning, as soon as as soon as a woman decides, hey, I want to keep it, I'm going to go forward with my pregnancy, you can get a doula right then. And then for some people, they keep it till just right after birth. And then postpartum doulas work about, I would say, 6 to 8 weeks. They'll go past uh postpartum with the mother or with their family. So that's, I would say, from about a year. So from the beginning of pregnancy to postpartum, 6 to 8 weeks is what can somebody can um what they can have with the doula, and it just depends on the type of doula. So for the most part, we're all freelancers. So I work with a birthing center just because I like the lady who owns it, and she's also a certified midwife, so I'm learning stuff from her as well. Um, so it could be like that, but like I said, many of them freelance. So the person that you pick, they might say, okay, yeah, I'd go from the very beginning. We can even beforehand, and we'll work on lactation and all types of things like that, as well as, and I'm done as soon as you have the baby. Or you have women who are like, okay, well, I'll start with you in your second trimester, and then we'll go to postpartum. Just kind of depends on doula to doula what the case can be.
Now, you mentioned midwife, and I know we talked about this earlier in the conversation. Is there a difference between a midwife and a doula? Because I noticed you said the midwife can be take the place of your OBGYN if they're on call or they're not available during the time of birth. So can or should you get a midwife and a doula? And also, again, previously, what's the difference between a midwife and a doula?
So the biggest difference between a doula and midwives and OBs and things like this is the medical part of it. So midwives are medical professionals. They're certified in that manner. Certified midwives and certified nurse midwives, they take a board exam, and those are master's or above level courses. And then obviously, an OB is a medical doctor. So that's the biggest difference. You can have both, actually, because there are a lot of doulas who are certified midwives and certified nurse midwives and things like that. So they're both sides of the same coin. But yeah, that's the biggest difference. I wouldn't say to choose necessarily one or the other. If anything, both. But if you can only afford one, and I might be biased because it's what I'm going to school for, but I would say a midwife because essentially they're there for the course of your whole pregnancy as well. So from the very beginning up until 6 weeks postpartum is how long, typically how long a midwife stays. Um, and you can get the same interaction that you would with a doula. However, I do feel like because doulas specifically work on emotional health care, really feel like if that's what someone is seeking, they should focus on that. So if you have a medical doctor that you're comfortable with and you're like, you want to know what, this is a great doctor, I love them, but because I know that they might not be available and I want somebody there, I'll just take the doula. Like that could be a good matchup too.
I love that. So I wouldn't say it's a la carte, but I would say that you need to determine whether or not you want a midwife or a doula based on your specific needs. So if it's more emotional, we want to look for a doula because they're also going to be there for you. But if it's more so on the medical side, and maybe unfortunately you're working with a doctor that may not be meeting all your needs medically, a midwife is more necessary because they're going to be the ones that kind of know the medical side and they'll be present even if the doctor or OBGYN in this case is not available during birth. I think that is
Mhm.
absolutely amazing and great advice to know. So when we're walking into those situations and we're going through pregnancy, we don't feel like we don't have support and we don't feel like we're not being heard and not being seen, which is so, so important. And I might say that one more time because it's so critical that new moms are getting their needs met. The medical professionals are listening to what the moms are saying and how they feel, because in most cases, it could be between life and death.
Mhm.
The stress, emotional support, it seems like a doula really can step in and provide that support that medical professionals may not be able to or are unable to. I find that very
Mhm.
interesting to say the least because pregnancy is a wellness. It's maternal wellness. It's more than just the medical side. You also have to look at your nutrition, exercise, looking at your emotional and mental capacity, just the hormonal changes, which also lean into the medical side as well. As a doula, and I know you're mentioning emotion support is the primary focus, is there anything outside the emotional support that you look at that kind of deals with the overall maternal wellness of a woman that is pregnant or a new mom?
I think a lot of it is stress maintenance. And then there are doulas who specialize in different different ways to give birth. So like standing up and things like that. So kind of the mechanisms of giving birth. And then there's some who specialize in what's it called? Like lactation. And then there are people who are just the whole thing or just postpartum. So it kind of depends on the again the needs of the woman. And then further, when it comes to physical health, which is part of the wellness, like I said, birthing mechanisms and how the body is going to react. And then I wouldn't necessarily say nutrition because nutrition is one of those things that it borders on medical because of the needs of the person. So there are some women who take prenatal vitamins and that's all they need throughout the course of their pregnancy. But then there are other women who, because they have some sort of pre uh or have some sort of other diagnosis where they have like high blood pressure or they have diabetes or certain medications that they already take that their nutrition has to be specified. I feel like doulas are good for helping find resources to do that and seeing uh, more natural methods to get certain things done. But outside of like when it comes to wellness, outside of like emotional situations, trying to think of like different things that I personally do. Because, like I said, for me, most of it is just stress maintenance. I don't want the mother to be stressed at all. I'm trying to figure out the ways to best reduce it.
But what would you say as a doula dealing with the emotional support in most cases stress, particularly chronic stress? What are some of the things that you would offer the woman going through pregnancy to try to help her manage her stress, or if in fact it may be anxiety?
If it's depending on how bad the anxiety is, it's really just mindfulness exercises, um, and ensuring that they're again checking in with themselves. I also think journaling is really important because the pregnancy journey it differs, it varies so much person to person that I think it's important for someone to write down exactly what they feel, how they're feeling all the time. Just like to be sure or to understand their own needs because you can't really understand them if you don't know how you're feeling. So that's one big thing. So journaling, mindfulness exercises, guided meditations, just having a moment where they can have silence or finding their happy place because some people's happy place is not silence. Some people like, certain type of music and things like that. And I always say that they should just go into putting themselves first. Uh, Even when they have multiple kids, like I understand that it can be difficult to have all these kids over here and try to focus on yourself. But that's the most important part of it is focusing on themselves and making sure that they're their priority at the time because it's not going to work any other way. And then another thing, and this is just me personally, because I enjoy exercise and I know that it makes me feel better, I often tell moms, go on a walk go on a walk, go to the gym, sit on the bike, whatever you need to do, because one, that's going to make you feel better. It just is. Exercise is good, unless there's some type of condition where they have to be on bed rest. And then on top of that, your body needs some type of motion, like that additional blood flow, those little bit of extra endorphins. That's going to help. So that's one thing that I stress a lot. If they are able and capable to get in some form of exercise, mostly walking, it'll always be helpful.
I love that you mentioned exercise, but I also think exercise is one of those things that one size does not fit all, especially when you're dealing with pregnancy, simply because of the medical risk that may be associated with too much movement as well as not enough movement. So, with that being said, as a doula, how do you work with the medical professionals and make sure if mom is insisting or a woman that is pregnant is insisting on exercising, working, doing a lot, providing for the family when essentially she probably should slow it down a little bit?
Sometimes you do have to put patients in timeout because they won't like some people get so hyper focused on something that they don't realize the damage that it does. And unfortunately, sometimes you do have to use a scare tactic and say, look, don't do this, then this is going to be your outcome, and we don't want this, right? Um, so it's sometimes it does take a putting your foot down, like, no, this is not what's going to happen. Now, with the patients or the women that I've worked with as a doula, it was in this birthing center. So because all of us know each other well enough to say, you need to go talk to her because she's over here trying to say that she wants to do this, this, and this, and she knows she can't. And then the medical professional or like the CM, she'll go, look, we've discussed this before. You're not going to the gym 4 times a week. Like we understand, what's going through your mind. And you have women who have body image issues or they come in with body dysmorphia. So all they can think of is, I don't want to put on all this baby weight. And you have to be like, look, if this is going to continue to be an issue, we're going to recommend that you go seek some therapeutic appointments because we're telling you that you can't do that because it's not safe for you and for your baby. But because you have this body dysmorphia, you can't stop yourself from wanting to do that, no matter how bad the consequences are. Now, when it comes to someone who's not in a birthing center situation where I would be hired as an outside doula and they're working with a medical professional, um, I don't know if I would have the same range of opinion in that situation just because I don't know the medical professional personally. So that's another thing that kind of just varies depending on the woman's relationship with the doula and the woman's relationship with her medical professional.
Now, with the medical professional piece, as well as you being a doula and soon to be certified midwife, how would you say that you need? I know I'm so excited for you. So, how would you say that it would be? Because I would think it would be important for the mom or the woman that is pregnant to kind of bridge the gap and make sure that the doula, the certified midwife, the OBGYN or the doctor that's handling the entire pregnancy medically on that side, that are all kind of like one team. So either in your own personal experience or what you think probably should happen because of your experiences working at doula, is it important to make sure everyone is working as a team? And if so, I know there's like HIPAA requirements and things of that nature. Like, how can a mom make sure everything is taken care of in that manner? Because I would think it's pretty dangerous if one person is kind of in their own little silo and then the other one's in their own little silo. So in the end, everyone's getting all these mixed messages and maybe something might get missed.
So if it is a situation where like mine where I'm inside a birthing center already, we don't really worry about that too much because all of the birth workers are in one place and we can speak to each other freely with the permission of the the woman. Now, if it's a situation where I'm a freelance doula and there's a doctor, I would have to get the permission of the mom to come with them. And the physician would also have to be like, yeah, this is perfectly fine to come in, just so that everybody's on the same page because it can't function. A birthing plan cannot function properly if all of the pieces of the birthing team aren't on the same page. So that's one of those things that's kind of the responsibility of the patient where you have to say, all right, well, I want my doula to be involved. So yes, they can come into appointments with me. Obviously sharing information without the patient there, they would have to get the permission from the patient to do that. But I also don't really feel like that's necessarily appropriate because it's such a singular uh it's such a specified situation. I don't feel like it would be appropriate for me as a doula to go contact somebody's medical professional and be like, hey, they're not doing X, Y, and Z because that's not really my business to tell them. That's something that the patient needs to tell their doctor themselves. But in a birthing center, it's a little different because, like I said, all the birth workers, we're all in the same place. We see, like, when a mother comes in, we all see them at the same time.
Like a birthing center has like a community effect, and the doctor's office or the hospital that would require more so of the patient being the first person to speak. And if they wanted to have a doula with them at that time, they would give permission for the doula to speak on their behalf.
Yeah. Pretty
Okay.
much. And that's the biggest difference. Honestly, it's more like the community aspect of childbirth is in a birthing center, everybody's close, everybody knows each other. And then when you're in a hospital, and not to say someone doesn't necessarily know their doctor, they might, and they might know the nurses that work there or whatever the case may be, but those people might not be there the next day. So that's the biggest difference. Like there can be a change of staff when you're dealing with a doctor's office or a hospital, but at a birthing center, or if you have your own midwife, own doula, there's a continuity of care.
Yeah, I love understanding the difference that you just mentioned between creating that team, making sure that your birthing plan, everyone is on the same page. And I just think having a birthing plan is so important, that not just to have one, but also to make sure that it's enforced. I know there's situations where there's emergencies, things may change at the last minute, and I would assume that all that is in the birthing plan. However,
Mhm.
what would you suggest to women that are pregnant or even new moms when the birthing plan just goes out the window? all of that time, effort put into making sure that the mom feels comfortable during the pregnancy process is essentially gone in a blink of a second because maybe a medical professional or maybe something happened that wasn't even considered or thought of at the moment. Like, what would you recommend or something that you would provide going through the mom's head at that point? Because there's no telling what she may be thinking at that point because she was solely relying on that birthing plan. Like, how would you, as a doula, support at that moment? Or how would you say that the mom needs to support herself if she doesn't have a doula at that moment?
I feel like contingency should be built into the birthing plan at the very beginning. At its inception, put down what would happen, what happens if. Now, some things you just can't plan for, but it's important to have down, okay, these are the what happens if. What happens if they tell me I can't give birth at the birthing center anymore and I have to be transferred over to a hospital? Which hospital do I want to go to? All of those things need to already be there. So I would initially say be as prepared as possible because you never know what can happen. So that's number one. But number two is don't panic. Very easy to say from the outside looking in. However, the less that there's panic, the easier it is to realize what decisions are being made. Because making a decision in a tizzy is sometimes it just don't work out well. And working yourself well while you're in the middle of maybe you have preterm labor or maybe what you thought was your water breaking really wasn't. Having those moments like that, or you have to stay calm or as calm as possible. So that's always my first thing. Don't panic. Like, look at me. We're doing this together. Just making sure that the mom knows that, hey, I'm here. I'm here. I am present. We're going to work through this together. This is a team effort. I don't, as a doula, I would never want my client to feel like she's alone in that moment of panic. No, we are here together. We're doing this together. You have my support 100%. What do you need from me? I'm going to hold your hand. If you think that something is going wrong, you let me know. I will yell it to the doctor. I will yell it to somebody else that you feel like something is wrong if you feel like you can't.
That support is so needed, especially in a moment that may not be accounted for or even planned for or even thought of. I would say definitely in my experience, just making things that potentially could be high risk, although they weren't high risk, something as common knowledge. Like for instance, like once you get diagnosed with preeclampsia, one of the high risk factors of that is having a stroke. And so once the mother is knowledgeable of that, they can look to see what are the signs and symptoms of a stroke. I know with the American Heart Association, they do FAST. That is the acronym to know that you're having or potentially having a stroke. And first is you just look at facial drooping. The A, if you have like any arm drooping, and S is speech. If your speech starts slurring or you notice you're not speaking as you typically would, and then T is for time to call 911. FAST is an easy acronym to learn. And once you familiarize yourself with the risks, if you are diagnosed with any pregnancy complications, then that is going through your head as sort of like a safety net. And then with that safety net, if you go through those moments of panic, it's like, okay, I know this is not good, but at least I can speak up and say, this is what's happening. So medically or even on the emotional side, you can make sure those needs and wants are expressed. And once they're expressed, your hope is that the medical team and everyone will jump in and make sure that they're giving you that attention as soon as possible. So your outcome is survival, and just being there as a new mom and being there to take care of your bundle of joy is something that is available to you. Worst case, unfortunately, sometimes, again, the United States has a high or one of the highest mortality rates in dealing with pregnancy complications, and just knowing your risk factors. I think that is so important. How would you say risk factors come in when it comes to having a birthing plan, especially working with a doula? Like, I know you're on the emotional side, and supportive side. However, if there is a complication that is diagnosed medically, is that something that you can step in and make sure the mom is knowledgeable of?
Oh yeah, definitely. Um, it's just as a doula, I feel like it's as much as it is emotional support, it's also like having an additional partner. So a lot of times you rely on your partner to do the things that you can't really do. And a doula can step in and do something similar. Never overstep the boundaries of that partner. But okay, you find out that you have a risk for preeclampsia or uh diabetes during pregnancy, we can, okay, what are our resources? What's your doctor telling you? Let's go over what they're saying. We'll go over that. What can we find? How do we fix your diet? Like, let's go to the grocery store. Let's find what you need. Let's go on Pinterest. Let's look up some recipes. It's it's going over those things with the client to make sure that they feel supported. At the end of the day, it's really, do you feel supported? What can I do to make sure you feel supported? Because there are things that somebody's excuse me, somebody's partner is not gonna maybe not gonna have time for because they're working full time to support the family. Um, so it's looking into things like that. So if my client comes to me and said, okay, well, my doctor says there's a chance that I could have uh diabetes or I could go into having preeclampsia. What do I do? It's like, okay, well, we'll cut back on this, or we'll try to introduce this solution, whatever the case may be at the time. So it's going over the risk factors and seeing what their doctor is telling them, and then creating our own plan on a more holistic side of what we can take care of.
I absolutely think that is amazing. And you said something so profound to me, making sure you have enough support. I would say pregnancy doesn't start alone and it shouldn't go alone and you shouldn't be alone. So find that support that you need to make sure that you are getting your needs met because it is so critical. You do not want to go through pregnancy alone. I think you mentioned some great advice about finding support groups. If it is an economic problem, finding resources. If it's affordable, insurance needs may provide it. Get a doula, a midwife, to add to your medical team in addition to a doctor when you're going through pregnancy. All those things are just absolute gems and much, much needed going through the pregnancy process. I would love if you could just leave us with a few words on what you would love mothers or new moms to know that are going through pregnancy or even postpartum, something that you wish every single mom knew. If you could just share that with us before we close out.
Um, the biggest thing, and to me, the most valuable thing, is that you are more than your title. You are not just a mom. You are not just a worker. You're not just anything. First and foremost, you are you, and you have to appreciate yourself and think about all of the things that you've done over the course of this 10 months. Okay, you've had a child, you've done that. Appreciate that you've done that for yourself. Oh, like you have to, I said it earlier and I'll say it again, you cannot be a good anything if you're not a good you. Take care of yourself so that you can take care of others. Cannot pour from an empty cup. It's very important that new moms or just moms in general understand that you have to take care of you, and don't be embarrassed or upset with yourself or let anyone make you feel bad about doing that, because you just gave birth. You're taking care of a child or taking care of children. You have to take care of you.
Thank you. Thank you so much. That is absolutely beautiful. I know everyone that is watching will be sharing this video for every single woman that is thinking about being pregnant, going through pregnancy, or even in the postpartum of pregnancy. Share this video. This discussion needs to be heard. We heard some incredible, incredible advice and information that needs to be shared with Miss Lexis Scott. So thank you so much for being here. I just appreciate everything that you have shared. I love having this conversation because it's so important and it's so needed. So I love everyone for watching. Again, share this video. Discussion must be heard. It was some powerful, powerful information that was shared that could basically be life saving. I love you for listening, and I will see you later.